Welcome to Cyber Survivor. I'm your host, Dan Dodson. Building communities is a cornerstone of building resiliency in cybersecurity. At the center of building these communities is one of my friends, Drex DeFord, who's the president of the 229 cyber community as a CISO and CIO, and I'm so glad you're on the pod. Drex, thanks for joining me.
Hey, it's good to be here. I feel like we're turnabout's fair play here. You've been on my show, now I'm on your show.
I know, and I'm so honored to have you here. I'm super excited to talk about the communities that you're building, why it's important, and what are you seeing in the healthcare environment at large. But most of everybody knows you, but if you would give a quick background on your career. I know it's a great one, so I look forward to hearing about it.
Oh, thanks. It's actually just a giant collection of accidental things that have sort of happened to me over the course of my life. Farm kid from Indiana, didn't have money to go to college, joined the Air Force, enlisted in the Air Force. Happened to be a computer guy when I went to school at night, finished my degree, and then got commissioned as a medical service corps officer, hospital administrator. So I wound up being the hospital administrator who knew something about computers. And this was in 1989, and there was no CIO job in the hospital. There was nothing like that. And so the rest of my career was just, I kind of grew up in the Air Force, small hospitals, large hospitals, ran one of our regions, one of our medical centers, and was chief technology officer for Air Force Health's worldwide operations in DC. And 20 years had magically gone by. And I retired from the military and then went to Scripps Health in San Diego, and then Seattle Children's, and then Steward Healthcare in Boston. And then became an independent consultant and did a bunch of work with hospitals and VC and PE firms and partners. And one of my customers was CrowdStrike. I helped them stand up the healthcare vertical and then became executive healthcare strategist there. And then 18 months ago, went to This Week Health to try to help build communities and make more of a difference in a different way.
Yeah, well, I know that you've certainly made a difference in a lot of different ways, Drex. We're appreciative of that. Talk to me a little bit about when you first got into healthcare cybersecurity. What did it look like compared to what it looks like today?
Oh, I mean, it's a whole different world, you know. When I first got into cybersecurity, I really started first thinking about cybersecurity. We did not have bad guys in the way that we think of the bad guys that we have today. We didn't spend a lot of time thinking about anybody really trying to hack into our networks or do anything untoward. So a lot of it was just about making sure that we weren't accidentally creating a situation where we were going to interfere with somebody else on the internet, or they were going to interfere with us and cause us to run slow or slow down. Being in the government, obviously, there were some protections that were in place to help protect our networks and the data that we had on our networks, but very, very different from the world we live in today. Even toward the end of my military career, of course, we were spending a lot of time talking about things like IoT and medical equipment and how to secure that stuff. We were much more focused on cybersecurity, but even at that point, we didn't have ransomware. We didn't have the kinds of things that we face today. And actually, in a lot of ways, those new kinds of attack vectors, those things are all sort of relatively modern compared to the whole history of the internet.
Yeah, and do you think that there's a correlation between kind of the rise in the digitization of healthcare, right? As we went through like the EHR boom and everybody got more digital records, and then that's connected to hundreds of other applications. So you have this kind of interoperability thing and really expanded the attack surface, which I think drove an opportunity, unfortunately, for some of our adversaries to take advantage of that. I mean, is that one of the driving factors as you think about that?
Yeah, absolutely. I've talked about this at other conferences that I've been lucky enough to be asked to present at. But, if you look back at 2008 was the economic downturn. 2007 was the economic downturn. 2008 was kind of the beginning of the turnaround. ARRA, the American Recovery and Reinvestment Act, was passed. Inside of that was high tech. Inside of that was the meaningful use, $40 billion for electronic health records. And, healthcare went from 10% EHR adoption to 95% EHR adoption, kind of over a period of about 4 years. Coincidentally, 2008 is also when Bitcoin was invented. And so we sort of had these magical crossing of paths at about the same time that we automated a bunch of stuff. ARRA, meaningful use, was all about getting electronic health records out there. There wasn't a lot of money in that bucket for cybersecurity. So we were automating these things. We were becoming very addicted. We had to have systems up and running for us to deliver good, safe care. And at the same time, the bad guys were given a new mechanism to be able to ransom those records and get paid. And it was untraceable. And we just crossed the streams at exactly the wrong time. And that has been a chronic problem, ever since Hollywood Hospital was kind of the first one that got ransomware.
Yeah, I mean, as you think back, do you think we should have been more proactive at the industry level of infusing more cyber responsibilities, accountabilities, frameworks, et cetera, into meaningful use?
I think it's really easy for us to be Monday morning quarterbacks and look back on it and kind of say we should have done this or we should have done that. We should have done more interoperability focus too. I think we would be much further along if we would have really implemented that as part of meaningful use. Certainly cybersecurity, as we know now, turns out to be very, very important. We not only did, meaningful use, when we got towards the tail end of meaningful use, all the research folks, all the business operations folks, they saw what technology could do. And they then came to the table and said, well, now that we're done with clinical, we would need a bunch of money to automate our stuff too. And there wasn't a lot of thought about cybersecurity as we went down that path either. We did get a little bit better and a little bit better over time, but it wasn't ever part of the program. So it would have been great if we would have added cybersecurity from the beginning. We say that all the time. It should be built in. It shouldn't be something that we sort of retrofit and add on later. But I think in a lot of ways, we've had some really smart people who have worked really hard and done their best. And it's easy to Monday morning quarterback again. I don't know that it does us much good. I have a friend who kind of talks about the windshield is this big and the rearview mirror is only this big. And so we should spend more time looking out the windshield and figuring out what we're doing next, not what we did wrong.
I love that, actually. That's a great point. And it's fascinating to me that one question I ask a lot of people just in my normal life, but also on the podcast is like, was it worth it, right? This promise of digitizing healthcare and, better coordinating of care and increasing quality. I think that there's a lot of people that can argue whether that also led to physician burnout. If you think of everything across the board, most people I talked to said, yes, it was worth it. Yes, we're delivering care more coordinated. Yes, to your point, there are things in the rearview mirror we might want to do differently. But by and large, people are energized about, look, it worked. It's helpful. It's providing better quality of care. I know you talked to a lot of people as well. What are you hearing out there?
I mean, I think generally speaking, the answer is it was worth it. When you think about, the original program, the meaningful use program, the idea behind that program was to, how do we turn the economy around? I mean, it was about deploying electronic health records, but it was really about how do we take a giant chunk of money and stick it into the economy and get as many jobs created as quickly as possible. A lot of interesting things happened during that period. Tons of little companies that would have never existed otherwise popped up to help health systems implement electronic health records. EHR companies that probably would have never existed. Two guys in a garage built an EHR, and that's used in a ton of clinics today. So there was a lot of good things that happened, innovative things that happened. This is a perfect example, though, of unintended consequences. There were a lot of unintended consequences. Physician burnout, folks who said, I'm not going to do this. I'm out of here. Physicians who probably ended their careers earlier than they needed to or would have otherwise. I think there's a lot of unintended consequences, but that may be with everything, not just cybersecurity or electronic health records.
No, I think that's a great point. And I think it's a great pivot off to the next big opportunity I think is in front of us as we think about maybe evaluating things that we found in the rearview mirror as we looked back, to use your analogy, which is AI, I mean, everybody's talking about that, right? And so I think we're at an interesting time where we can consider some of the cybersecurity elements surrounding the use of AI in a more responsible way. How are you thinking about AI, and how are you hearing your communities talk about it?
I think as often as we talked about unintended consequences, there's also this unintended opportunity. Because if we wouldn't have done this, we wouldn't have the opportunity now that we have for artificial intelligence or the LLM models that are being built, that I think ultimately will make things better for patients and families. And it's interesting to see things like ambient listening come into the market, and literally having conversations with physicians who say, like, this is going to extend my career. This is the thing that's going to keep me from quitting. Right. So they're willing to stay several more years, a few more years. It extends their time. Maybe ultimately they can see more patients and do more stuff. And it's not just ambient listening, but there are so many great opportunities out there for this technology to help us find and diagnose disease earlier, take care of patients, give patients access in ways that they've never had access before to their own records, gives us a new way to use data that we have that we were only sort of rudimentary trying to go through that data and figure out, are there patterns? Are there things that we should see or we should be seeing? AI is going to help us with all of that. So I'm excited for where we are with AI. I would say, to reapply that same salve again. As often as I say, oh man, that's really cool, I often say, oh shit, that's also, I probably shouldn't say that. As often as I say, oh wow, that's really cool, I also say, oh no, that could be a really, really bad thing too. So it's a double-edged sword. And I think we have to be very thoughtful about how we use AI in healthcare,
I
in
agree with you
everything.
completely that being thoughtful is extraordinarily important. How have you seen some organizations think through the challenge of adopting AI? And one thing that I like to talk about is, it's kind of like text messaging back in the day. Like, physicians are not supposed to text, patient information to their colleagues, right? We've been fighting that battle forever because it's a collaboration tool for them, right? They have a weird case. They want to talk to somebody that they know. Hey, what do you think about this? It's all for the good, but there's certainly cyber risks associated with that, or privacy risks.
Mm-hmm.
I feel like as people start using AI tools, whether they're embedded into, a SaaS application they're buying, or the EHR, or, publicly available things like ChatGPT, how do we wrap our brains around that as an industry and make sure that we're using it responsibly without hamstringing people too much?
I mean, it's really interesting that, the other thing that happened during the pandemic is that we shifted a lot of our work to SaaS models from applications that we run in-house. And so with a lot of SaaS models, we wake up on Thursday and there are new artificial intelligence buttons that we can click and do things in those SaaS apps that we didn't get a heads up on. There weren't necessarily release notes. We didn't do any testing. We didn't really have time to sort of think about, how do we tell the staff, yeah, you should use that, or no, probably not. The button's just there. And people being the way people are, they will use it. And so a lot of this is also just, I think, the consistent conversation with your teams about what good looks like, how to be thoughtful about the use of artificial intelligence, the general conversations to around, this is a model, this particular model of the GPT is something we only run internally. So it's okay if you put patient data in there because it's for us only, versus the models that are public models that are used on the internet, that when you put things in there, everybody now has access to them. They're used to train the model and do lots of other stuff. So a lot of it is just kind of general awareness, helping people understand what AI is. That definition alone can be a real conversation to have, but also how to use it, how not to use it. And I say, stay a little paranoid all the time in my podcast, but there's a little bit of paranoia that needs to be applied to all of these things. And just think before you click the button, think before you cut and paste. All of that kind of stuff makes this easier for us to manage, maybe.
Yeah, maybe is the key word. We hope, right?
Right.
It's like anything. The end user is going to be the riskiest, element to the kill chain, so
Yeah,
to speak, from the
absolutely.
adversary. So, talk to me a little bit about, you made this transition from inside the four walls of the hospital to the vendor side, and now you're building communities. What drove you to want to do that?
Man, really, I mean, that's really a great question. I don't think that there was any. I have folks ask me about this kind of career path question all the time, and the answer really is there was no plan. I think my plan was the way I've kind of gone through my career has been where can I do, where can I go, what job can I do where I can do the most good in the shortest amount of time, and that usually meant going to places that were really messed up so I could have a quick impact and kind of turnaround. I was really a turnaround guy. Even inside the Air Force, I was a turnaround guy. And so that helped me develop a set of criteria, and that criteria were things like that's the kind of place I want to work at, but also these are the kinds of people I want to work with. That helped me sort of think through my fellow execs. Who do I want them to be? How do I want them to behave? But it also helped me think through things like, where do I want to live? And if your criteria around where do you want to live is, I don't care, I'll live anywhere, you get a lot more opportunities. And so it was more sort of applying some of those personal criteria to opportunities that came my way that put me in some of the positions that I was in, and the opportunities I was able to take advantage of. I think the other part of this too is just, you do the best job you can at the job that you're doing. And I don't think it's just your job. It's also volunteer opportunities. I've volunteered in a lot of associations and done a lot of outside work to try to make healthcare better, and people notice. And so when they have an opportunity, they think of, this might be a good person to help with that. So I've had a lot of opportunity like that. Dan, I'm super lucky. I mean, ultimately, it's what it boils down to is that I've been super, super lucky going through my life, that I've had a lot of these opportunities and I've taken advantage and they've worked out. And, good for me. I do feel super lucky every day.
Yeah. Well, I think you've made an impact on a lot of people in all those steps, Drex. We've known each other for a number of years now, and it's been amazing to see the type of impact that you've had in various different roles. So, tip of the hat to you, and appreciate what you're doing, not only in your community, but for the industry at large. As you've been on this journey for the last year and a half, building communities, you and I talk a lot about, look, the bad guys are talking all the time. Like, how do we create space in cybersecurity for the good guys to talk and share information and create these Chatham House rules types of opportunities? How have you found that journey so far, and what are some of the things that you've liked most about it?
It's been great to kind of see. So we do, we started off originally just doing summits, which were 2.5-day events. We bring 15 execs together, and there's no keynotes and there's no panels. It's literally just 15 execs talking to each other about all the hard stuff that they're working on and successes. And that has really created, when I talk to the folks who are attending or the folks who are coming for the first time, I tell them that there will be a lot of great conversations that happen inside that room, and you'll learn a lot inside that room. But the real magic is the connections that you make with other people in the room that last after the meeting is over. That's where we saw the weak point in major conferences that we had gone to and been a part of for years. Folks were calling us, as an independent consultant. Folks were calling me at COVID. This is where the 229 comes from. February 29th of 2020 was the first case of a death from COVID reported to the CDC. And around that time, I started getting phone calls from folks saying, can you introduce me to so-and-so? They're doing this cool stuff with COVID. And I was like, I've seen the two of you sitting next to each other at insert big name conference. You're telling me you don't know that person? And their answer was, I'm an acquaintance with them. I don't really know them. I don't have their phone number, which caused Bill and Sarah and I from the 229 project to kind of think through I think there's a problem here. I think there's an opportunity for us to make this better. And so when you bring those people together and they really do connect and they continue to have those strong relationships afterwards, it's fun now, 18 months later, to go back to city tour dinners, which we've added, and sit down with people and they tell me, those 3 people that I met at this summit are I don't do anything without talking to them first, right? They are my world-class consultant team that I'm now relying on every day. And that's exactly, warms my heart. That's exactly what we're looking for. It's too hard to be out there by yourself working on these problems and trying to solve these problems. You really do. We talk about security being a team sport all the time, but man, it really is much better when when you've got a hard problem, you can text 20 of your friends and 15 of them will respond in 15 minutes and give you some really good insights in what to do next. So I think for me and for all of us at the 229 Project, that's been the key to the operation. The events are amazing. It's the post-game activity that turns out to be the thing that makes the community a real community.
Yeah, no, I think that's awesome. And the other thing that I'm sure folks and people that I've talked to that have been to the 229 events will often say too is that there's a level of comfort too, that understanding that you're not on an island, right? Your colleagues and peers are dealing with some of the same challenges that you are, And so when you're in the 4 walls of your hospital, man, it gets pretty lonely. If you're a CIO or a CISO or a CTO and, you're in the trenches working hard on grocery store margin budgets and dealing with the realities of the health system, that community can sometimes, be a breath of fresh air and a calm voice in a big storm. So
well, it lets you know too that you're not, sometimes we hear people say, wow, I thought I was just stupid and I wasn't able to figure this out. But it turns out everybody in the room is not stupid, but everybody in the room, no one's got it figured out, right? Which makes me feel good. And sometimes it's a combination when we're all together of group therapy or misery loves company, or whatever the case may be. My job as the moderator in these sessions can sometimes turn out to be somebody says, oh, my car is in the ditch. And then somebody else says, yeah, my car is in the ditch too. I really hate that my car is in the ditch. And then, at some point I step in and say, I love that you all are commiserating about this. How are we going to get the car out of the ditch? And that really then drives that next level conversation. So folks do like knowing that there are other people like them, an organization like theirs with problems like theirs, but there's a route out. And, crowdsourcing really smart ideas, working together, and not just the CISOs working together, working with the partners that are in the room too, because from a team sport perspective, it is the health systems, it is the partners, it is the government. There are lots of folks who are involved in making this world that we live in better. It's not just the CISO one on their own or a group of CISOs. It really is the much larger community that we're building.
Yeah, absolutely. No question about that. Speaking of that community, what are some of the topics that you guys have risen to the top as you've talked about, current pressing issues in cybersecurity?
Yeah, of course AI is one of those big ones because everyone's trying to figure that out. I think we struggle. We hear a lot of folks continue to struggle with third-party risk management as we move to SaaS. As we have partners who may have their own cybersecurity incidents or their own situations, that causes problems for those health systems, not just from a compliance perspective, but often from a supply chain perspective. I literally can't do that work anymore, whatever it may turn out to be, because I have a partner down or a partner offline. There are I'm sitting here, let me look. I have a list right over here, actually, as we prepare for the next summit. Folks are talking about things like all the things that happen in Epic and the tools that are used and the challenges with what happens when the electronic health record goes down, thoughts about minimum viable hospital, resilience. the idea that we really are in this world now where when the electronic health record goes down or any of our systems go down, we have a workforce that doesn't know how to do things without computer systems. They went through medical school. They went through nursing school. They had an electronic health record the whole time. And so when the system is down, they become very concerned for the patient and family, that the patient and family has a good experience and that it's a good, safe experience. But they also become concerned for themselves too, and their particular situation that they might do something wrong by accident because they don't have electronic health records there to help them through their treatment diagnosis of patients. And if they make a mistake, that could be the end of their career. That could take their license away. So they worry about that. And our job in all of this ultimately is to try to help. I think our job as healthcare executives, I still think of myself as that too, but our job as healthcare executives is to try to create a situation where they can focus on the thing they should be focused on, which is the patient and family, and not be distracted by technology or all the other things that are going on. If we can do that, then as healthcare execs, I think we've done our jobs. And that's really a lot of the work that we're trying to drive into place in the 229 summits.
Yeah. Talk to me a little bit more about this minimal viable hospital. Last time we spoke, you mentioned this to me. I was not familiar with the term, full disclosure, but I've done some research in there. So how are you thinking that will play out in the market?
I think it's a really interesting, opportunity. It's a really interesting way to sort of think about this. The idea that you have an isolated recovery environment that is separate from the network that you normally work on, so that when something happens, you have a backup plan that you can go to right away and bring online right away. Now, the challenge in all of this, as is often the challenge in healthcare, is we have, I will stereotype here, but generally speaking, we have a really hard time prioritizing things. What we may really have is a really hard time deprioritizing some things. And so minimum viable hospital becomes sort of the same challenge. When you have 600 applications on your network and the people who use those applications all think that might be the most important application that you're running, you have to make some really, really hard decisions. But the idea that we could at least get a system up to take care of patients in some kind of a degraded way, maybe not as many patients, maybe not doing as many surgeries, maybe not filling as many beds, but we could at least provide some level of safe care with electronic health records and other records that are necessary, other systems that are necessary to help take care of patients. We could do it in a way that was safe. That's a great approach to this, especially in smaller places, rural hospitals, places where without the electronic health record, if that system is shut down, if that health system is shut down, the next care that patient can get is 100 miles away or 3 hours away. That's a death sentence for some people who are injured in car wrecks or farming accidents. Having grown up on a farm, like it's the worst scenario possible. So if we can keep people running so they can take care of at least some of the basics, while the rest of the recovery happens, it's a good plan. And so a lot of people are thinking about this now, thinking about what's the best way to put it together. How's it going to work? How's it going to impact them from a patient family perspective?
Yeah, I think it's a great concept. I do agree with you that there are some very specific challenges around the number of applications that are needed to actually deliver care. I think those that aren't in the battle every day don't realize that, what you said is true, that there's hundreds of applications that power a hospital, right?
A lot of it is the prerequisites too. It's not, we think about, we'll just bring the electronic health record up, but actually there are a whole bunch of things that have to happen before the electronic health record can come up. And then there's a whole bunch of things and applications that have to interact with the electronic health record for lab to work and radiology to work, and right on down the line. So it's not just one system. It's usually some significant combination of systems to get even to that MBH level of operation.
Yeah, and fighting the battle to figure out which ones are the top priority, I think, is certainly a governance challenge, which we find everywhere.
There's going to be politics
healthcare
involved in that, just as there is with everything else. Yeah,
that's right. That's right. So you also mentioned third-party risk. That's a topic that we've all been talking about for years. How do you think we're doing at the industry level? We making progress there, or just too many challenges and too many additional vendors, or how do you think about that?
I don't know. It is definitely challenging. There's some of this is the, perfect is the enemy of good, I think. And so having conversations, I mean, a lot of this is like, it starts with the basics. Do you know who all of your third parties are? Like, a lot of organizations don't really know that. They have contracts, but if you ask them to show you the contract, they may not even be able to produce the contract, let alone the associated BAA, let alone any other documentation they may have for that contract. Some of these contracts are legacy contracts, and they've been done for a while, and we just keep signing the renewals, and they keep running. So a lot of this is just like with everything else, anything in cybersecurity. The fundamentals start with the basics. Do you have the contract? Do you have language written into the contract that is the kind of language that compels that third-party partner to let you know when they think perhaps they're having a cyber incident, so that you can make some decisions about what to do next. But of course, all the things that you need to go through to make sure that they're running a good cyber program, something that you can at least get on board with, right? I don't think any CISO thinks that their third parties should, we would all love for them to run a perfect cybersecurity program. The reality is, I think what most CISOs want is to know that their third parties are running a good cybersecurity program. Of course, they're going to have holes, they're going to have problems. They're working through them. They know what they are. They have an attack plan for those. That's what we're expecting from our third-party partners. And so that challenge, though, of when you have 600 applications and you have a bunch of as a service stuff that's going on, and you have a bunch of other third-party suppliers, you're looking at them. You would need an army of people to really stay on top of all of those suppliers and make sure that they're perfect. And that's a challenge even for the largest organizations. What are you seeing as you look at third-party risk? What's the best play right now?
Yeah, I would say that certainly over the last couple of years, awareness has increased, which I think is the step one, Drex. I think, to your point, I think organizations are talking about it. I think we're starting to wrap our brains around around what is third-party risk. I think we're starting to risk stratify the vendors within the healthcare organization. I think a lot of organizations are doing the questionnaire-based model to just gain a baseline understanding, right? I think that what data am I exchanging? How am I exchanging that data? What does that relationship look like technically? What are some of the safeguards that are in place or not in place on either my side at the hospital or the vendor side? So I think we're kind of in that gaining more awareness. What I haven't seen yet is, at scale, when we evaluate a vendor, if they have a poor cybersecurity posture, we're not doing business with that vendor, right? Like, there's not enough at scale. I'm sure we have clients, I'm sure there are people out there that have made the decision that we're not going to do it because it's so bad. But at scale, oftentimes, I think there's this internal pressure in the health system of, either a physician or one of my management colleagues wants this. So I've got to figure out a solution to do it, right? And so then I'm kind of left with if I do the assessment, but I know I got to say yes to the vendor anyways, why am I doing the assessment? And my response is look, if we know what it looks like, then we can put some compensating controls in place, right? Or work with the business to understand how we can better utilize it. Maybe we can send them less data, right? Only the data that they need, and those types of controls. And so I think we're early innings at the industry level, but I've been proud of the progress we've made from an awareness perspective, I guess is what I would say.
I think it's interesting to, you make some other really great points, the kinds of things you should write into your contract. What data does that third party really need from you? The easy thing for the third party is to say, just open up and just let me have anything on the network or anything in the electronic health record. But the reality is they maybe only need 25 fields. So do the work ahead of time and let them only have access to 25 fields. How long do they need to keep that data for the work that they're doing for you? The easy button is they just keep it forever. Well, when they get breached, they've got 1 million records, right? But if they really only need it for 60 days, create a process in the documentation that says that they delete the data after 60 days and they certify to you that the data is gone. So there's a lot of those kinds of things that you can reduce the risk associated with third-party partners by, again, a lot of this is kind of back to the fundamentals and asking sort of the fundamental basic questions that put you in a good position to be successful. Somebody described to me the other day that all of their third parties are just like girlfriends or boyfriends that they know those girlfriends or boyfriends are going to break their heart. And so what they're trying to do is get some kind of an idea about how the girlfriend or boyfriend is going to break their heart and how likely it is they're going to break their heart. That's what their third-party assessment program is kind of all about. It's not perfect. They're just trying to figure out, like, are we going to date for 6 months? Are we going to date for a year before you break my heart? I thought that was kind of a really endearing way. I don't know, endearing. It was an interesting way to think about it.
I think it's a great way to think about it. I also think that you can, put a prenup in place to make sure you're protected, right? Know what you're getting into and put the prenup in place.
That's it.
Yeah, but I think it's going to run a very similar path to it just increases our attack surface, right? Every time we enter into a new third-party agreement, no different than our email attack surface, right? We've seen lots of organizations try to think through inside their organization, like who needs external email? Mm-hmm. We're trying to reduce the attack surface. I think there's ways we can do that in the third-party realm as well that will help ultimately, hopefully better protect us.
I mean, it's interesting when you talk about email and business email compromise, and a lot of this is also gets into the fundamentals of who inside the organization needs email at all, who in the organization needs email that is connected to the outside world. And so those are really hard. I mean, when we've all grown up with, if you have email, you have access to everything with email. Now you have to start laying in some hard and fast rules. The other part of business email compromise that I see happen all the time is that somebody's been in a health system for 20 years and their email box has 20 years worth of stuff in it. All those reports that have automatically dumped out of the EHR or out of the knowledge management system into their email box, those are all still there. So when a bad guy gets into the email system and you don't have any way of actually saying where the bad guy went inside the email system, you have to assume that Dr. Smith and their 20 years worth of crap that's in their email box, that all has been compromised. And so you have to report it. Even though that's probably not what happened, they probably wanted to just get in and use an email to try to spoof somebody into giving up some credentials or something. You have to disclose everything. So those hard issues too about email retention and, what kind of data actually goes into your email box. All those are really hard, difficult, political things that the teams have to deal with today. I don't envy them. I like doing what I'm doing at this point.
Sleep a little easier today, huh?
There's a little PTSD every time I do a 229 Summit or a city tour dinner and I hear folks talk about some of their challenges. I'm like, wow, they have the hardest job in the world now. And it's not getting any easier.
I agree with that. Let's end on a positive note. What are some of the progress that you've seen us make in cybersecurity and healthcare? What are some of the areas that you think the industry's made good progress on?
I think that when you look at, for me, some of the work that we've done around connections and sharing data, I like the HISAC, obviously. I like some of the work that Now, for anything that I say that's going to be good, I'm also going to say I don't think we're going fast enough. I worry about things like the CISA law that's probably going to expire soon. Not that CISA, but the other CISA law that's going to expire soon. This ability to be able to share information and not get in trouble because you've shared information. We need to have more of that kind of capability. But I think we've made progress. And I think, if I was going to kind of pull out one thing, I would say it's that. If I was going to pull out another thing, I think that we are making good progress with technology, and we're in the early stages using AI and technology to help take pressure off people in the SOC to be able to see what's happening in their environment, understand what's happening sooner, because speed is the key to the operation now. You have to be able to find these things and diagnose them, and either find them and cut them off, or find them and analyze, is this a good thing or a bad thing? And you have to do it within minutes. And it's hard to do it when it's all human based, and you have to have all those humans there 24 hours a day, 7 days a week, even on holidays. We have technology that is starting to be able to help with that, and that's making a big difference too. What do you think is on top of the game right now?
Yeah, well, I would say that what I've been most impressed with over the last couple of years is the cyber teams within these healthcare organizations. They know a lot of the fundamentals they need to be doing. I think the next step is making sure that they have the resources and the know-how to do that, right? I mean, I do feel like at the industry level, we have hundreds, probably thousands of people that are truly committed to providing safe environments so that these organizations can deliver clinical care in a safe way. Now it's just making sure they get the right resources, the right training, and the right talent to be able to do it. But I'm always really, really impressed with the commitment and the level of insights that a lot of these people have. It's just a matter of getting them the right resources, Drex.
There's some really interesting things like the Health Sector Coordinating Council and the work that some of the tools that they've produced that kind of are the fundamental roadmaps of the things that you need to do to be successful. And when you look at, the NPRM, the proposed rule for HIPAA security that came out at the end of the Biden administration and kind of got caught up in the no more regulation turn of the early Trump administration. But when you look at kind of the intention of those rules, almost everything that you would see in those rules were like, this is good. You're right. We should totally be doing this. Now, the challenge came in the timeline and the resources to be able to do it and all those sorts of things. I'm with you. I think we understand very, very well what we should do. The challenge is, do we have the resources to do it? Do we have the time to do it, given the environment that especially we live in right now?
Yeah. The other thing I would pull out too is I think that cybersecurity as a challenge I think we've done a decent job making progress in getting that message across the entire C-suite, right? I mean, it wasn't that long ago where, I'm not saying people don't still have to fight for dollars and stuff like that, of course. But there's a lot more broader knowledge, I think, across the C-suite, CEOs, boards, those types of things. I think there has been progress in that area as well, as far as like awareness of this to help hopefully move things forward.
Yeah, I'm with you. I think there's a lot more briefings that happen at the board level so they see what's going on. I hear and see things cybersecurity issues being integrated into bonus plans for non-cybersecurity and even IT execs. Things like executives having, as part of the bonus program, the scores of the phishing that happens on their teams. So what's happened, because you have that integration, is that frontline managers are now saying to their teams during their daily huddles, and don't forget, don't click on those emails. If you think there's something wrong, make sure that you send it to fish@organization.org. So it's kind of, you're right on the money. There's way more visibility now than there's ever been before.
I agree. Well, Drex, as we're wrapping up, where do people find you if they want to get plugged into your community? Where's the best way to get connected with you and the 229 group?
Absolutely. If you go to thisweekhealth.com, you'll find kind of all the social media stuff that we do. Thisweekhealth.com/unhack will take you to my shows, my podcasts, and then 229 Project, the 229 Project, 229project.com, all the events that we're doing, all the other kind of training that we're doing now for sales professionals. All that stuff's available online there. So yeah, and you can always reach out to me, Drex at thisweekhealth.com.
Drex, thank you so much for your time today. I'm honored to be with you and learn from you as always. And thanks so much for what you're doing to build strong cyber communities here. I'm Dan Dodson, and this is Cyber Survivor.